بسم الله الرحمن الرحيم إذا زلزلت الأرض زلزالها وأخرجت الأرض أثقالها وقال الإنسان ما لها يومئذ تحدث أخبارها بأن ربك أوحى لها يومئذ يصدر الناس أشتاتا ليروا أعمالهم فمن يعمل مثقال ذرة خيرا يره ومن يعمل مثقال ذرة شرا يره.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Neliswe Msomi. I'm a health journalist. I've been a health journalist for almost 5 years now. And today I've been tasked to speak about universal health coverage in Islam. At first, we would like to start at what is universal health coverage. Well, it is the universal principle of wanting to get access to healthcare services for all and quality healthcare services for all. So it is a principle that ensures that there's equity and equality in access to good healthcare services for everybody, despite their race, their gender, their social standing. So basically, where you are born, or whatever career you're in, your right to health is protected because your positioning as a person should not determine whether you get good healthcare or not. And this is the basis of principle, after the 1972 Declaration of Universal Health Coverage at the UN. And a lot of parts of the world are adopting this policy in their envisioning, in applying it in their healthcare systems. In South Africa, currently we have two healthcare systems, the private and the public. It's a healthcare system that was developed during the time of apartheid. It was developed and it is rooted in anti-blackness. It is rooted in inequality, and it's meant to serve those who are wealthy, the haves, those who are privileged, and the majority of the country do not have access to quality healthcare services. I mean, a lot of the times when we talk about universal health and you juxtapose it to what we have as a healthcare system in South Africa, people always say that, but healthcare was good during apartheid. And as like everything else, it becomes difficult to compare why it was good in apartheid and why it's not functioning well right now. Because right now, the healthcare system, healthcare facilities that were meant for white people and who are a small minority, is now overburdened the majority of people. So the way the healthcare system is designed right now, it is failing the majority because it was not designed for the capacity of the majority. And so we understand that our current healthcare system, the public healthcare system to be specific, 80% of the population relies on it. And in that 80%, even those who are able to afford medical aid are part of it, because it's when your medical aid runs out, where do you lean towards when you need healthcare? And this is one of the things that universal healthcare seeks to solve or resolve, that the wealth that you have or access to health should not be determined by the wealth that you have. And even if you are able to afford medical aid, what we are seeing now is that it's increasingly becoming too unaffordable for people who are on it. So in order for everybody to have equal access to good healthcare services, you would need a universal healthcare system that makes it possible for everybody to access good health. And in South Africa, we are currently, or Parliament is currently debating the National Health Insurance, which is the ruling party's version of what they envision as universal health care. In America, there's Obamacare. That's the Democrats' version of what universal healthcare is. But in South Africa, we have the NHI, and the NHI is what the ruling party, the ANC, envisions of what they think universal healthcare would look like. And for them, it's a policy document that's currently being debated in Parliament on whether they're gonna pass it or not, and it's being debated on amendments and so forth, and in all other parliamentary processes that it needs to go through. But what it's meant to do is to correct the current flaws in the healthcare system. So, and building capacity for our healthcare system and our especially for the majority of the population. The healthcare facilities that we currently have that are in bad conditions, to renovate those, to build new ones so there's better access, because what we are seeing is that when you're building houses or new areas being developed or new settlements being developed, you need a clinic there, you need a hospital nearby. So those things are being considered. The training of healthcare workers, because we are facing a shortage of healthcare workers in the country, and it is important that we train more healthcare workers to fill that gap, even with the current infrastructure that we have. So by building infrastructure, you need to also train healthcare workers that are going to be working within that infrastructure. And in our current infrastructures, we need to fill the gaps that are there. And it's also strengthening primary healthcare facilities. So these are your normal clinics and your community healthcare centers, which are accessible to the public. Almost every area normally has a clinic or a community healthcare center, which normally operates for 24 hours, and by strengthening those, you are essentially making it easier that hospitals have less feet. Less people are admitted in hospitals. Your first point of care is your community healthcare center, and if you can strengthen that, all your clinics, your community healthcare center or your clinics, and if you can strengthen those two in delivering healthcare services, then we would have covered the majority of the ground, and that means our hospitals will not be overcrowded. And it also encourages a public-private partnership, and I think we are really seeing it right now with the current pandemic, where even when private healthcare hospitals don't have space, they rely on public health, and it's an exchange of skills between the two. So essentially, it is bridging the gap between the inequality gap between the rich and the poor, and basically saying that your social standing should not be a determining factor on the type of healthcare services that you receive. So what does Islam say about universal healthcare coverage? For me as a Muslim, I feel that Islam is a social justice movement to the core. When Islam came, it came to correct the wrongs of the Arab society then, and took that message forward across the world. In its essence, it's a universal message. It's not just for a certain tribe or for a certain nation, as we've seen with other prophets. When Allah gave the message to our beloved Prophet Muhammad sallallahu alaihi wasallam, it was a universal message for all. And because of this, the the essence of Islam being very justice driven and being universal in its structure, the universal health coverage becomes incumbent for us as Muslims to advocate for it. Because one of the most important things is that about Islam is that we have to preserve life, and preserving life means better access to quality health and access for all to quality health. Because even Allah subhanahu wa ta'ala says in the Quran, Surah Ma'idah and Ayah 32, He says, if you had saved a single life, it is as though you have saved the whole of humanity. And saving a life, in today's times especially, is about bringing about quality healthcare services to people, delivering that and advocating for that. And it becomes compulsory as a Muslim that we fight any injustice that we see. We know that hadith, that very famous hadith about if you see injustice, fight it with your hand. If you can't fight it with your hand, use your tongue. If you can't use your tongue, make a dua. But alhamdulillah, we are in a stage where, as South Africa, we are in a democratic state, and we have rights, and we need to implement those rights. And a lot of what's in the constitution is very much in line with what Islam says. Section 27 of the constitution speaks about the right of health. Like, every person has the right to health and access to quality health care. And Section 10 of the Constitution speaks about the right of dignity, how your right as a person, just being a person, being born on this earth in the South African soil, you have a right to be protected and you have a right to be respected. And proper healthcare services gives you that. It gives you your dignity. You are protected. And it is up to us as Muslims in our state of propagating Islam, is that we do not forget the health component of it. Our approach to dawah has always been spiritual, but the spirit cannot function if the body is not in a healthy state. And the injustice of the current healthcare system that was designed in apartheid is something that we need to fight. We've seen that as Muslims in this country, and how we have fought and against the apartheid regime. We were part of the people who fought against the injustices that came with that regime. And it is also it is still incumbent upon us to fight the legacies of that regime. And healthcare is one of them. Access to quality healthcare is one of the factors that show the inequality of South Africa. We cannot be, as Muslims, be comfortable in the inequality that we live in. And I say this because I had the privilege to be one of the few journalists who covered the National Health Insurance public hearings across the country. So we moved province to province with Parliament's Portfolio Committee on Health to get commentary and opinions on what they think the policy document of the National Health Insurance is, what should be amended, how they feel about the current healthcare system, and what should be changed and what should be fixed, and so forth. And we went all over the country, in all 9 provinces. And in the places that we went to, I was very disappointed to see that I only saw one Muslim in Durban. One Muslim who came and spoke about the National Health Insurance. This is the future of healthcare in the country, but because our attitude as Muslims in the country is that we isolate ourselves from everybody else. When we do work around, around healthcare, for example, when there's a shortage of oxygen, we think about running up resources for the Muslim community. We don't think about the rest of society because we don't see ourselves outside those lenses. And because of that, it becomes hard for us to blend in with other people within our society. And we need to remember that even our non-Muslims, friends, colleagues, family, etc., have rights over us as Muslims, and we are failing that because we do not think that social justice, within that context, within the South African context, is important. So we don't see how it is important for us as Muslims to stand up for rights of everybody in the country. And that takes away the essence of Islam, because Islam is universal. How else do we do dawah but through our actions? We can give out as many pamphlets as we want, but if people do not see action from a Muslim community, then it is not dawah. And fighting for a healthcare system that accommodates all of us is very important. I was in a conversation with a Muslim elder 1 or 2 years ago, around the NHI. She invited me on her show, and one of the things that disturbed me that she said was that she cannot have her domestic worker go to the same healthcare facility as her. She works too hard for her money, and pays a lot of money for medical aid. So why would she wanna go to the same healthcare facility as her domestic worker? Why would her domestic worker have the same have access to a good quality healthcare system that she pays for? And it was disappointing because Islam is a religion, not just a religion, but a movement of closing inequality gaps. And to hear somebody that prominent in the Muslim community, firstly displaying racism, not recognizing that the domestic worker too works hard, and just that's like the erasure of her work. Domestic worker keeps her house afloat and working, and not seeing her domestic worker as a human who also deserves a right to good life, a right to proper healthcare. Because healthcare is a determining factor between life and death. And if we are as Muslims supposed to preserve life, then it is incumbent upon us to fight that for those who don't have a platform to voice themselves, and for those who don't have the resources to get access to proper health. And because as Muslims we don't see ourselves as part of the greater society, we are failing our neighbors, we are failing our families, we are failing our friends and colleagues in their approach, in our approach to bring about justice in South Africa. It is our duty to bring about health justice. And I think this pandemic that we are going through is highlighting that, that it's affecting us all. It's not choosy, it is affecting us all. It doesn't say because you're a Muslim, you cannot get coronavirus. It is affecting us all. It has taken lives of many, and it is important that that we fight for a cause where access to healthcare is one for all. Where a child in Guguletu can get the same quality of healthcare as a child in Camps Bay, for example. It is about leveling the playing field. It's about leveling the access to quality healthcare. And it's such an important thing as a Muslim, when you see the injustices that we face around the world, that we do not become blind to the injustices that are in our own backyard. It is important that we rally ourselves up, mobilize ourselves and our resources to ensure that everybody in this country, despite their race, gender, class, religion, have access to proper healthcare services, especially in a time like now of COVID-19, where we need to be together, we need to be united with the whole of society, not just the Muslim community, when we rally up our resources. In my final word, I'd just like to quote Nabi Sallallahu Alaihi Wasallam. He says, when you see believers, regard yourselves as one body. yeah, he says believers are believers regard themselves as one body. When one part of the body is in pain, the whole body feels its impact. And that's how it is. If the one part of society is in pain, all of us should feel the impact. And that's what universal healthcare coverage is that the feeling of pain is for us all, and healing helps us all. Thank you so much for listening to me and for the invite from the Claremont Mosque. Appreciate you guys calling me. I hope I've imparted something and of benefit to everybody who's watching. May Allah keep us safe, heal those who are sick, and have mercy on us all. Assalamu alaikum wa rahmatullahi wa barakatuh.
بسم الله الرحمن الرحيم اللهم رب الناس أذهب البأس واشف أنت الشافي لا شفاء إلا شفاءك شفاء لا يغادر سقما اشف مرضانا نسألك اللهم أن تشفيهم من هذا الوباء كرونا اللهم آنس قلوبهم بنور وجهك الكريم اشف أجسامنا وأنفسنا بحبك ورحمتك وأن نتوكل دائما على رحمتك الواسعة والحمد لله رب العالمين.